everyone, I'm Mark Lewis. Welcome to another special edition of Arizona Doc Talk, brought to you by azccc, the Arizona Center for Cancer Care, where we bring you information that's salient and that consumers need regarding cancer and treatment. And today's topic is what you need to know about fertility and cancer treatment. I'll be discussing this with two doctors who will join me, who I would like to introduce to you now. Dr. Vinay Ganala of the Southwest Fertility Center was born and raised in Phoenix, Arizona. He received his undergraduate degree in physiology and neuroscience at the University of California, San Diego, and his medical degree from the University of Arizona College of Medicine in Tucson. He recently completed his residency training in OB/GYN and fellowship in infertility at Weill Cornell Medical Center in New York. Dr. Ganala specializes in all aspects of reproductive medicine, offering patients a full range of fertility services. The depth of Dr. Ganala's clinical practice is mirrored by his vast contribution of clinical research to the scientific field. He has published several original research articles that are featured in peer-reviewed journals. Dr. Stephanie Lindauer specializes in medical oncology, hematology, and internal medicine. Her clinical interests include breast cancer, gastrointestinal cancer, hematologic malignancies, and cancer survivorship. Dr. Lindauer joined Arizona Center for Cancer Care in 2018. She has several abstracts and poster presentations at local and national meetings, including ASCO Survivorship Symposium, ASCO Quality Care Symposium, and ASH Hematologic Malignancies. Dr. Lindauer was drawn to the field of oncology from a young age, having seen the effects of cancer in loved ones. She feels honored to be able to fulfill such an important role now and strives for compassion and empathy with all of her patients. Well, we really appreciate both of you being here to talk about a very delicate and emotional topic, cancer as it relates to fertility. Let's start at the basics for people. When these two topics come up, how do you work in synchronization with one another?
So when we're talking about fertility and cancer, we can talk about it in various stages of cancer diagnosis, treatment, and survivorship. So depending on what type of cancer the patient has and what treatments that they end up getting, we work together with to figure out what the best approach is to either preserving fertility as best we can or trying to give them the best shot at having a pregnancy or having children down the road after treatment.
So Dr. Ganala, when you work with the oncology side of things, you have to ascertain what stage the disease process is at or has moved towards, and then you determine your plan of action from your perspective?
Correct. So it depends on where we are in the cancer kind of journey. And if we're at the point where it was just recently diagnosed, then one of the most important and beneficial things that we can offer is fertility preservation, or preserving that man or woman's fertility, because cancer treatment will affect that fertility. If it happens to be after that diagnosis and treatment has undergone, then once they are in remission, then if they needed assistance with their fertility, then at that point it would be treatment to help them conceive at that time.
And it's very difficult to talk specifics because each case has its own unique characteristics. But when we look at the man and the woman in general and how they manifest the characteristics of going through cancer and then trying to preserve fertility, what are some of the commonalities that exist between the man and the woman going forward?
So it depends on, again, the case and what treatment that we're given, but as far as commonalities, chemotherapy in general, most of our chemotherapies will be toxic to either the ovaries in a woman or just the reproductive tract in general for both men and women. And so knowing that, and if we have a treatment plan in place, knowing that using chemotherapy will harm the reproductive tract, we can try and plan the best scenario for future fertility.
So would you then maybe minimize and increase levels depending on how it responds?
Not necessarily. So we always want to treat the cancer first and foremost, and if this is a curative type of cancer, of course, be true to the doses that we need to use and the frequency of chemotherapy that we need to use. But depending on where we are in that stage, if we're talking about a woman with, say, newly diagnosed breast cancer who is in reproductive age, we may talk to her about cryopreservation or other techniques to try and preserve fertility. Or we may, in men, also talk about sperm banking and things like that. So it kind of just depends on where they are in their treatment.
And that's where you come in. From your perspective, then you try to harvest as many eggs and or sperm and preserve it until the disease process is arrested?
Has been completed, yes. So as Dr. Lindauer is saying, there's a huge number of variety of chemotherapy regimens that can sometimes include radiation or not, but both radiation to the pelvis and all chemotherapy will have some type of a toxic effect on that woman's ability to make eggs and also the male's ability to make sperm. And so therefore their kind of ovarian or testicular age will be much more advanced than actually their chronological age from the toxic effects of the chemotherapy. So preserving one's fertility would either be a male producing sperm and freezing sperm in a number of vials that he could then use later on after treatment has been completed and he's in remission, or for the side of a female would be undergoing ovarian stimulation with IVF to freeze eggs or embryos, knowing that after the chemotherapy and radiation treatment, her egg count will be much less.
From a behavioral standpoint, this is a very emotional topic because having children, if you can't, and if that's what you desire to have, is so emotional. And if it's impacted by a double whammy like the cancer that's thrown in there at the same time, do you have that component as a resource with other clinicians that you work with to help the families deal with the behavioral aspect of it?
Yeah, so anytime you get a new cancer diagnosis, that's already very stressful to go through. And I think a lot of times for people, both men and women in their reproductive ages who, maybe haven't started a family yet, when we first meet in the office, our initial knee-jerk reaction is to let's get the treatment started, let's get either chemotherapy or let's get our surgery done or let's get our radiation done, and they really want to start the cancer treatments right away, which is important, and that's what we as oncologists want as well. But it's important to just take a deep breath and really address with our patients whether they desire a family and whether they want that option of having a family down the road, because I think we all too often we get caught up in that cancer treatment and don't ask about that, and then there are regrets later on. And so that there's a lot of emotion and a lot of big decisions to be made during that time, which is very, very stressful for the patient and their family. So yes, we do have those resources. I mean, we have social workers and psychologists, and then of course working with experts like Dr. Gunala in that field. Coordinating care between us is really important, and keeping that line of communication so that people can feel that they make a very informed decision and are not rushed into treatments and having regrets later on in life.
And especially for you, because it's supposed to be a joyous time, right, for people to want to come in to conceive, to nurture that child and take it through the cycle of birth. But when it's mitigated by a disease process, you have something else on your plate that you have to deal with. So how do you personally deal with that? Again, is it just circumstantial to the individual and just trying to read how they respond?
Absolutely. I think, as Dr. Lindauer said, it's a diagnosis that is met with that is life-changing, right? And everybody's going to experience that differently, but there's so many different facets that go into maintaining the care of that patient. And in my experience, I would say focusing on fertility or fertility potential or even fertility preservation, that gives the patient and the couple something that they can look forward to for the future, and therefore not necessarily also treat the cancer, but then gives them something to look forward to after, and provide hopefully hope that there is life potentially after cancer, and that can involve still having a family.
Well, and speaking of hope, let's say if it's an individual like myself, obviously I'm too old, I'm past childbearing, and my kids are 26 and 24. I'm fine. I'm fine where I am right now. But someone who is younger, let's say a man who had testicular cancer, but went through the regimen, is doing fine, but then wants to revisit with his new spouse, having a child, and he comes to confer with both of you about what is the best method for him to do so. What do you say from both sides of where you sit?
So in that particular scenario with testicular cancer, obviously there's an important surveillance protocol that we follow, and we monitor these patients for recurrences, which sometimes do happen. So from my standpoint, as long as they're kind of following with that protocol and getting scans and blood work and follow-up appointments and everything, then it kind of just depends on what treatment that he received for his testicular cancer, and usually that involves a combination of surgery, sometimes chemotherapy, sometimes radiation and therapy. So that is going to impact probably his ability to have children. But that's where the planning ahead comes into play, and is important to when you're initially planning the treatment to see if he can sperm bank or things like that.
Absolutely. I think we as fertility specialists are by no means dictating the care, and our utmost concern is the patient, either male or female, who has that cancer diagnosis and their health. But we can kind of offer a beacon of hope for the future of just preserving their fertility. So in that example of testicular cancer, we actually have a patient that is ours right now, and they had that diagnosis. He was a male at a relatively young age, and he froze and did sperm banking and froze multiple vials of sperm prior to the therapy, and now he's in remission. And unfortunately, the cancer, although it did great in controlling the cancer and eradicating it, it could really shut down his sperm production. So, but because we have vials that are frozen of sperm, now they have ability to have a family.
So a lot of the times, as we've discussed on many of these segments, the protocols are preparation. Make sure that the preparation's intact, and that those protocols have been followed, because down the road that will be very critical.
Right, and I think that is why it's so important to talk about this on a program such as this, because I think even if that woman or man doesn't end up going forward with sperm banking, or doesn't end up going forward with cryopreservation or things like that, at least having that discussion. We have multiple studies that show that young people in general feel that their reproductive needs are not really as well addressed as maybe their actual cancer treatment, and so it's something that we kind of forget, I think, sometimes to bring up. But at least even meeting with someone like Dr. Kunala, even if they don't proceed with preserving their fertility, having that discussion is very important. And so that kind of goes back to all of the pre-planning and bringing it up from the very beginning as an important part of the cancer care.
Because if I'm a man and I've got testicular cancer and I want to save some sperm for down the road after the treatment regimen's gone, you have to tell me that some of that sperm will survive regardless of where you are now, depending on how you ascertain the progress of the disease, correct?
Absolutely. And if you're asking about the freezing of sperm and eggs or embryos right now, our fertility world has kind of undergone a lot of advancements in that freezing technology. So the ability for sperm to freeze and survive that freezing and thawing process and then using it in the future is very good, as well as now with eggs and embryos in the last decade, there's been much more advances with that. So nothing is a sure policy, but with the advancements of technology, we have now been able to preserve these sperm or eggs or embryos without really compromising them.
Well, and I think that's a perfect segue for this segment to end, and to tell people, stay with us though, because in our second segment we'll get a little bit deeper into those specific treatments, what's out there, just how that whole landscape has changed in our lifetimes, and where you see it going from here. So we appreciate you watching. This is brought to you by azccc, the Arizona for Cancer Care. My name is Mark Lewis. You can get more information on our website at azccc.com.